from Leopold University, Tabaco Campus, BSN 2A. So in this video, I will be demonstrating or performing the Leopold's maneuver. So the Leopold's maneuver are used to palpate the gravid uterus systematically. This is done after 36 weeks of pregnancy. So this method of abdominal palpation is of low cost, easy to perform, and non-invasive. It is used to determine the attitude, the fetal presentation, the presenting part, the degree of descent, estimated fetal size, fetal back, fetal heart tone, number of fetus, position, and engagement of the fetus in the uterus. For the procedure, so first I'm going to introduce myself. So, ma'am, good afternoon po. My name is Chelsea Leopold and I am the side nurse for you today po. So, can I just confirm for your name po?
Jessa Maribarbaten.
Okay, Ma'am Jessa. So, ngayon po, ma'am, I will be performing Leopold's maneuver po. In this procedure, I will palpate po your abdomen slowly and then I will add a little pressure for me to be able to feel and determine the position of your baby in the uterus. So, when you feel uncomfortable, ma'am, you can tell me right away po and I will stop, okay? Then, in this procedure po, I assure you that it will not hurt you nor your baby. So, next is instruct the client to empty the bladder. So, ma'am, pwede po, nakapag-void na po ba kayo? Nakapag-ihi na po ba kayo?
Yes.
Okay po. Then, position the client in the dorsal recumbent position. Okay, so my patient is already in dorsal recumbent position, which is her extremities are lifted. Then, provide client's privacy. Then, drape the client exposing only the parts needed for the procedure. Next is perform hand washing. So, I already performed hand washing earlier. Then, next is dry and warm hands by rubbing them against each other briskly before placing them on the abdomen. So we go now to the first maneuver, which is the fundal grip. So the fundal grip is used to determine the location of the fetal head and fetal buttocks, and to use this when measuring for the fundal height. So for the procedure, face the woman's head. Place both hands flat on her upper abdomen and palpate gently to detect which part of the uterus lies in the fundus of the uterus. Okay? Okay. So in this procedure, if the head is positioned at the upper part of the uterus, the head will feel hard, round, and movable. But if it is the baby's bottom, it will feel irregular. Okay po? So, we go now to the second maneuver, which is the umbilical grip. So, in this procedure, it is to determine the location of the fetal back. So, for the procedure, I'm going to palpate the size of the abdomen to detect location of the fetal back and fetal small parts. So, hold the left hand stationary on the left side of the uterus, while the right hand palpates the opposite side of the uterus from top to bottom. Then hold the right hand steady and repeat palpation using the left hand on the left side of the uterus. Okay? Okay po. So in this procedure, if we feel the fetal back, it should be smooth on one side, and in the side where it indicates the fingers, the toes, and knees, it should feel like irregular bumps or lumps. Okay? Then for the third maneuver, so we have the Pollex grip. So it is to determine what fetal part is lying above the inlet or lower abdomen. So for the procedure, I'm going to palpate the lower abdomen by gently grasping the area just above the symphysis pubis between the thumb and the index finger, and try to press the thumb and finger together. So determine any movement and whether the part is firm or soft to detect what occupies the pelvic inlet and whether or not it is engaged. Okay, ma'am, so are you okay po? Do you feel any pain po? Okay po, so I'll continue. Okay, thank you po. So for the fourth maneuver, which is the pelvic grip. So it is to determine engagement of the fetal presenting part. Okay, so for the fourth maneuver, which is the pelvic grip, so it is to determine engagement of the fetal presenting part. So for the procedure, so facing the foot part of the client, palpate the abdomen by placing fingers on both sides and inwards in the direction of the birth canal. So allow fingers to be carried downward to detect head's degree of flexion, position, and even station. Okay po? Okay. So in this procedure, we will be able to determine flexion or extension of the baby's head if this is the presenting part. So that is why we are going to position ourselves here facing the mother's feet. Okay, so ma'am, I'm done po doing the Leopold's maneuver. So for the for the next step, which is to inform the client of results. Okay, so ma'am, I'm done po with the procedure. So okay, so based on the procedure done po, I have felt and determined that your baby is encephalic presentation because the head of your baby is at the lower part of your uterus. Yes, then it is also engaged. This is a good thing for you po and your baby because this finding is the ideal and normal findings for a pregnant woman after 36 weeks of pregnancy. Then, okay, so I'm done. Then next is wash hands. Then pull down the gown to cover the abdomen and document the findings. That's all.